All right, how much does the skin weigh on an average person? Since it is the largest organ in our body, multiple functions, very important. The skin is about 6 to 8 pounds on an average person. If you're a little bit larger, then definitely a lot more. What type of tissue is the skin? There's only 4 tissue types. So is it epithelial? Is it connective? Is it muscle? Or is it nerves? Which one is it? Does it create a border? It's epithelial. So skin is going to be epithelial. So it's the covering, just like epithelial does. Largest organ as mentioned. And we'll talk about the accessory organs. So the hair follicles, nails, glands, all of your different receptors, blood vessels, and nerves. First line defense. So definitely keep what's supposed to be outside out and what's supposed to be inside in. So protection from infection. Not just bacteria and virus, but probably fungus as well. And some parasites. UV radiation, definitely. Your pigmentation will help. So you'll block UV light one of 2 ways. Either your skin will absorb it or scatter the UV light. With the oils in your skin and the proteins, it makes the skin pretty much watertight. Help prevent water loss. Regulation of body temperature. Name me one way the skin regulates body temperature. Sweat. So the evaporation properties of water will take with it a lot of heat. How about the blood vessels? Right? They can open and close to regulate your body temperature. So when you're hot, what happens? Do they open or close?
They open.
They open. So you'll be flush and red, so all the heat goes to the surface in order to dissipate it from the body. The opposite, if it's cold, frostbite. So you'll lose blood flows to the non-essential areas. Your fingers and toes you can live without. So all the blood will go to your internal organs. When you get embarrassed, what happens? Yeah. All the blood goes to the surface of your skin and you feel kind of hot. Vitamin D production. In combination with cholesterol in your skin, UV light will create the precursor to vitamin D. So it's actually the liver that produces vitamin D, but it needs the building blocks. So cholesterol with UV light will create the building blocks for vitamin D. Essential for calcium absorption. The other organs are for sensations. We have different receptors. One for heat, one for cold, one for pressure, one for pain, one for deep pressure. And an additional function of the skin is excretion. So the top layer of skin has no blood supply, so toxins will actually leak out of your skin. Have you guys done the foot spa? So supposedly that foot spa will help draw toxins out of the large pores of this or large pores of the feet. Epi for above. So above the dermis is the epidermis. Notice there is no blood supply. So nutrients will leak from the dermis layer up and if there's any toxins, it'll be just excreted through the skin. In fact, certain drugs will measure the dosage based on the patient's body surface area. So you'll measure how much surface area they have and dose them accordingly. So not just weight, but also body surface area will determine dosing. Dermis, this is where all the main organs are going to be, including the blood vessels. So no blood supply in the epidermis. The dermis is rich with blood supply and nerves. Under the skin, hypo for below, aka subcutaneous. Sub is below. Cutane is another word root for skin, aka adipose. So adipose is all that lovely yellow stuff here, and that is the fat. Some drugs you'll administer to the dermal layer. Some drugs you'll administer to the fat layer, and other drugs you'll administer to the muscle. So right below the fat, you should have the muscle layer. Intradermal, subcutaneous, and intramuscular injections. Superficial layer, dermis. So we're only going to talk about the two layers of the epidermis. So the outermost layer is the stratum corneum. So just think of corns, like corns on the feet. So that's going to be the outermost layer, corneum. The layer right below that, where the epidermis cells are dividing, is going to be the basal layer, the stratum basal. So this is where they are dividing. And as skin grows, right, the skin gets flatter and flatter and flatter. So it covers more surface area. So as it pushes up, it flattens out. And as the skin is maturing, it's also being keratinized. So the protein keratin is embedded in this epidermis. So keratin is embedded by, of course, keratinocytes, the cells that lay down the protein keratin. And this is what gives the skin its toughness and its waterproofness. So it's only that top layer that gets keratinized. Keratin is also the same protein that your fingernails are made of and that your hair is made of. Other places you'll find keratin, the cornea in your eye and the lens of your eye. That's also keratin protein. Just a little bit different structure. Melanocytes, cells that produce the pigment melanin. So this is the protein that gives you your pigmentation. So there's a brown melanin, a darker one, and also a red. So it comes in different colors as well. So as you guys research in the discussion, by now you guys know everybody has the same amount of melanocytes. So we all have the same count regardless of skin tone. It is the activity that differs between individuals with different complexion. And it's not just one gene that makes up your skin tone, it's multiple genes. So that was the epidermis. Now let's get into the dermis, more complex, and where all the accessory organs are located. Sodorific, this is the word for sweat. Sebum or sebaceous, that is oil. So you produce different types of secretions. An oily secretion that conditions the skin and hair, and then a watery secretion that when evaporates help control body temperature. We'll further divide these sodorific glands. Hair follicles, so this is the cup shape without follicles. You don't get hair growing. Hair is just modified skin. So just like skin grows and gets pushed up and out, same thing with hair. It grows, get keratinized, and it pushes up and out of the hair root. Wrinkles. What causes wrinkles? If you knew, I wouldn't have any. What? Smiles? Age? The sun? Stress? So what happens is you lose these proteins, collagen and elastin. And like they say, it gives the skin, it's like bouncy, water-filled firmness, and the elastin gives it's the elasticity. So what happens is underneath your wrinkles, you lose collagen and elastin, and the wrinkles become more defined. So when you're young, there's a lot of elastin and collagen below the wrinkles, and you can't tell that they're there. So how do you get rid of wrinkles? They inject collagen and elastin underneath those folds to bring them back up, so the wrinkles are less noticeable. Blood vessels, definitely blood supply here, and also a nervous supply. Underneath the dermis, aka hypodermis, and sometimes they'll just call it the adipose as well, aka that's fat. So that's storage of fat. The good thing is you usually have the same number of fat cells unless you're morbidly obese, and those fat cells will start to divide. All right, from the top, outermost layer, stratum corneum. The second layer of the epidermis is the basal layer. No blood supply. So what causes the wrinkles in your skin? Let's say when you take a bath. Right. So it's actually a nervous system response. So people who don't have nerves going to their feet or hands do not develop wrinkles. Pretty crazy. So wrinkles is, yeah, you get water in, but it's also a nervous response. It's for better grip when it's wet. So the wrinkles that you'll see is the wave where the skin is actually attached, anchored at certain points. Here's the hair follicle. So that's like that cup shape where it builds the shaft, the hair root and the hair shaft. Erector pili, the goosebump muscle. Can you guys control your goosebumps? So what type of muscle is it? Smooth muscle. Right? So when you're scared, it automatically pops up. When you're cold, they automatically pop up. So when you're scared, to make yourself look bigger. And then when you're cold, to fluff up the hair that you might have. Here's some fat, all that yellow stuff. And then we have the glands. Notice the sudorific sweat gland. Eccrine is watery sweat. T-E-R-O. There's two types of sweat. There's a watery sweat and a stinky sweat. So eccrine gland, that's the watery sweat. It's not going to be that stinky. Sebaceous is oil. Notice that the products come out of the hair shaft, and that's what they're designed to do. Condition the hair and the skin. So every time you shampoo, what do you remove? The conditioning oils. So you shampoo, you remove the healthy protective oils. So how do you put those oils back in? Yeah, you use your conditioner. Notice the sweat glands, they don't come out of a hair shaft. They just come out of a hole in the skin. Not the number of melanocytes determines your skin color, but the activity. So it is a trait, but more than just one or two that determines it. Hemoglobin plus oxygen has a nice reddish color. So underneath the skin, if it's highly oxygenated, you should see a reddish color. So look at the nail beds. That's one way to diagnose. Sometimes they'll look under the eyes, the eyelids. When there's a lot of carbon dioxide in the blood, the person will appear bluish. So the term for the bluish color is cyanosis. Have you guys heard of that term? Cyanosis. So cyano is blue. Osis is a condition. So literally a condition of being blue. We'll just cover the skin lesions quickly. I won't go over all of them, but it can be as simple as a freckle to all the way up to cancer, and anything in between is a skin lesion. So it's a disruption in the skin. So what's the deadliest type of skin cancer? Do you guys recall? From yesterday's assignment?
70%.
No, not the most common. We'll get to it. The deadliest is we'll get to it. We'll get to it in the subsequent slide. Just keep that in the back of your mind. Primary lesion. So that is the disease state that causes the problem with the skin. Secondary is from trauma. So bumps, scrapes, bruises. And the third category has to do with blood vessels. So if you disrupt blood vessels, break them, blisters with blood, then those are going to be vascular. So I won't go through all the terms, just so the term to know on this slide will be ecchymosis. That's the medical term for a bloody bruise. So based on the stage of healing, you might have some beautiful colors, some green, yellows, purples, and blues as the bruise heal. And if you see patients coming in with bruise at different stages of healing, that is a red flag for abuse. So it is your job to notify the proper authorities. It's not your job to judge if there is abuse or not. So especially if you see it on children or the elderly. Erosion. So part of the skin is pretty much rubbed away, worn away. Bedridden patients. A lot of times we'll get erosion on the heel, the back of the heel, buttocks, on their upper back, elbows. Rotate your patients every hour or two. Fissures. So we have normal folds in the skin, and sometimes those folds, they start to tear. So for example, the anus. Right? So any sphincter will have folds of skin, and you see how here there's kind of deep lines. So just imagine those deep lines start to crack, and then they start to tear, and you can't really stop using your anus, so you might get a real big problem. Chia, just little blisters. It looks like little tiny pimples, but it's actually hemorrhages. The blood vessel, little tiny blood vessels under the skin are bursting, and that's why you'll see those little red pinpoints. Tumor. So uncontrolled growth, that's a tumor. A lot of tumors are caused by virus, because a virus attacks DNA. So healthy cellular DNA might then become cancerous. So a tumor is not a cancer until it's malignant, starts to spread and colonize other areas of the body. Ulcers, similar to erosion. And then when you give the TB screening, the PPD or TB screening, you want a wheal to form. So the medical term for that little bubble under the skin is a wheal, aka a hive. Very similar to a blister, but a blister is usually fluid filled under the skin. Should you pop blisters? It all depends. It's recommended that you don't.
Like the fluid inside of it's healing itself. Isn't that or no?
Well, it's damaged. So what happens is the layer of skin is detached. So what happens is fluid will start to accumulate underneath it. So if you have like shoes that are too loose, right? Anytime you plant your feet slide inside the shoe. So what it does is it rubs the skin layer and it peels it off, literally your body, and then in between that, water accumulates, and that's what causes the blister.
What about a burn?
Like a rug burn?
Or like a regular burn? Like
Oh, yeah.
To a blister?
Yeah, that's your body's injury response is blood flow, which will bring in fluid flow. Again, with burns, they recommend you not to pop the blister. So if there is a cauterization procedure, they're going to get blisters afterwards, and you're supposed to tell the patient, don't pop them. Pretty crazy. If you lose hair follicles, you will lose hair, right? You have to have follicles. So they're just tube-like, and then as they grow, they push the hair up and up. So hair is just modified skin cell that is keratinized to give it its strength. Alopecia. So men usually have male pattern baldness. So that is that sex-linked gene. But for women, they usually have thinning of the hair or hair loss. And then the goose pimple muscle is the erector pili. Sodorific. So this is sweat. So there's a couple types. There's actually 3 different types. So eccrine is watery. And this is usually not going to cause stink. Not going to cause a lot of smell. So when kids are before puberty, they can run around, sweat, but they won't stink because their sweat is mostly just water. As the child ages and start to enter puberty, then they'll get this thicker sweat. So the thicker sweat will have proteins, oils, and that serves as food for bacteria. So during puberty, they'll start to develop more in the axial area, under the arms, the groin area. And now when these kids run around and get a little sweaty, they'll start to stink. With the right amount of estrogen, these apocrine glands that used to make sweat will turn into the milk glands, and they'll start to produce milk. So they change into milk producing glands during puberty. Sebaceous gland, of course, sebum is oil, conditions the skin and protects the hair, and also prevents bacterial growth. So in order for bacteria to infect you, they have to lay down kind of like a foundation. So they call that the biofilm of bacteria. So if you have a layer of oil, right, or a layer of wax in your ears, then that bacteria can't lay down a foundation. They can't cause an infection. So that's an extra function of the sebum. What are nails made out of? What's that? Keratin, yeah. So depending on how the keratin is structurally aligned or put together will determine its property. So here nails are fairly clear. So just imagine that similar structure for your eyes. Your cornea is also made out of keratin, and its arrangement makes it clear as well. So in order for your nail to grow, you have to have the nail root. So this is similar to the hair follicle. So if you ever jammed your finger in a door, car door, or run a marathon and you lost your toenail, right? It'll grow back as long as these cells are intact. You might get a nasty looking nail for a while, but afterwards you should get a healthy nail growing back. Lunula, it's white because there's no blood supply, and then the nail body should be pink. A lot of conditions they can tell by the nails. One is they'll press it to see circulation flow. Also, if there's ridges, they can read it just like the rings of a tree, good years, bad years. And if you see a chemo patient, someone with cancer treatment, you'll actually see the ridges because they'll get treatment every other month or every month, and then every month they'll get a ridge, and then no ridge, and then ridge based on the nutrition level. Anybody have cats? So to declaw cats, you actually have to amputate almost part of their digit, because to get rid of that nail bed. Skin healing. So inflammation response. So that's part of your injury and immune system. So blood vessels open, bringing in heat, blood, and fluids. So swelling takes place. And it's usually local. So the hormones that affect inflammation only works on the area that's injured. You get pain because of all of the fluid in between the cells. They press on the pain receptors, the free nerve endings, and that's why you'll feel pain with inflammation. So blood vessels dilate, bringing in blood. So with this, the immune cells as well. So you get a lot of white blood cells to clear away debris, and extra nutrients to promote repair. So an injury occurs to the skin, you'll get a blood clot that forms. So you have platelets that activate. So they're just like fibers that get turned on, and then red blood cells get trapped and other fibers get trapped. Right? So that dries, creates a scab. So that is to protect, control what goes in and out. But you still have a loss of some skin tissue underneath the scab. So you have the scab, and then you still have lost skin underneath. So the next place is to get rid of that wrinkle. So we got to build it up with collagen and elastin. How is scar tissue different from healthy skin? Is it hard or soft?
Soft.
Scar tissue?
Oh, wait.
Yeah, some scar tissue will actually contract and continue to get harder. Hair or no hair?
No hair.
Pores or no pores? Usually no pores. So it's a harder time to regulate body temperature for some burn victims. Burns, degree of burns. So we'll talk about the rule of nines. Why is it important to determine 9% of the body being burned or not?
So you can determine which one to save first.
What's likely to happen? Yeah, so at 9% of the body being burned or more, the patient is likely to go into shock. So that's when the body pretty much shuts down. Blood pressure goes down, heart rate stops, stop breathing. And to treat a patient after they burn, one of the hardest things to control is their body temperature. So some of these patients will actually be put in a tent so we can better control their body temperature. All right, 11 areas. What's 11 times 9?
99.
So that's 99%. And the genitals, we give it 1%. So all you gotta do is remember the 11 areas, right? So it's pretty easy. The head. right? The whole head. Arm. The whole left arm is 9%. The whole right arm is 9%. Right? Whoops. Left leg. Right leg. 18%. So the whole left leg is 18%. The whole right leg is 18%. 8, 9, 10, and 11. Front, back. So front of the torso, right? This whole area, that's 18%. The back side, that's 18%. So hopefully that helps you guys figure out percent burnt of a patient. So head, left arm, right arm. Left leg is 18%. Right leg is 18%. The front of the torso is 18%. The back of the torso. So here it is pictorially. So the entire head, front and back, is 9%. So that's 1. We got the right arm, left arm, 2 and 3. Front and back leg, 4, 5. Front and back, 6, 7. Torso, 8, 9. Back of torso, 10 and 11. So just remember those 11 portions and divide it accordingly. So if it's half the torso, then 9%. If it's half the arm, then the whole arm front and back, 4.5%, because the whole arm is 9. That's how you want to approach the rule of 9 problems. First, second, and third degree burn. So partial thickness and full thickness burn. So it could be just the epidermis only. And when that happens, you might get a little swelling, maybe a small blister that forms. You will feel pain. Partial thickness. Now we enter into some of the dermis. So you're going to be damaging accessory organs. Blisters. This is the most painful because the pain receptors are in the dermis. Whereas in full thickness, right, it's going to be pretty much charred. And what did you burn off? The pain receptors. So full thickness burn usually don't cause pain, but they're dangerous because now we can't regulate body temperature, we can't regulate water. So partial thickness, first degree. Partial thickness, part of the dermis. And then full thickness all the way down to the subcutaneous layer, notably with some charring. Old wives' tale, right? Put some butter on it. Why did they say put butter on it? Where is butter usually stored? In the fridge, so it's usually cool, right? And it feels good. But no, you don't want butter, any food for bacteria on your burn. Right? So definitely none of that stuff. All you want to do is run it under what type of water? Cold, cool, hot, warm water? Cool. Cool. Not cold, right? Cold might damage the burn area. So you want cool water. Not ice cold water, not cold, just cool. Cover it. Sterile plastic. That'll prevent infection and it drying up or anything drying to it. which is kind of bad. Get emergency services, and then of course check airways for swelling. Cancers and diseases. As you age, you may need to take pictures of the lesions on your skin to see if they change shape or move about. So in nursing home, that's a common practice. Once a week, once a month, they'll take out the Polaroid camera, the digital camera nowadays, and then they'll just take pictures of each other and document it. Types of skin cancer. So the most common is basal cell. So about 90% of all skin cancer is basal cell. Squamous, that's the top layer. This is the second most common. So these two aren't that deadly. The deadly one is this one, malignant melanoma. Basal cell most common, squamous top layer second, then melanoma deadly. So we'll talk about the three types. Get you some images. So basal cell, smooth, red, flat, or a little lumpy, not too bad. Okay, if you see this, get it checked out. Easel removal, easily removed. Electro, so they can cauterize it in electricity, or they can just cut it. So keratin is cutting thin slices, layer by layer, until you remove all of the cancerous growth. Squamous cell, so this is the top layer of skin, so a little less common. Still not deadly, and as long as it stays localized, they can just remove it. The deadly one, malignant melanoma. So if you see a freckle change shape, color, position, thickness, then that might be a sign of skin cancer. So get it checked out. All right, ABCDE rules. So these are the things you want to look out to determine if it might be cancer or not. Surgery, definitely, and they usually remove some healthy tissue along the borders as well. And then just in case they miss some cells, they'll follow up with chemotherapy. That way, if it breaks apart, enters the bloodstream, we'll catch it with the chemicals. They used to use immunotherapy for melanoma. They took the patient's T cells out of their body, they grew them, and they put it back into the patient. So it kind of like supercharging their immune system. And sometimes it works in treating their cancer. ABCDE rule. Asymmetry. So the borders are not symmetrical. And the borders may be raised, irregular, or changing. Color. Color changes, not consistent. D. Diameter. So anything larger than a pencil eraser, monitor it. And then changing, always changing, always. Color. Cancer stages. We want to catch cancer as early as possible. So for men, digital examination. Women, self-breast examination, colonoscopy. Now you got to do your skin check, your mole check. So if it runs in the family, do your checks more often. So in the skin only, it has not spread. That is stage 1. It is just localized. We catch it here, usually quick surgery, and that's about it. Stage 1. It is now 1 1 to 2 millimeters thick. It's starting to invade nearby structures. Stage 2, a lot more. Stage 3, in this case stage 3A, is when some of the cancer has broken into the lymphatic system. So you have lymph nodes throughout your whole body. So this is the beginning of the spread. At stage 4, pretty much really hard to treat because it's pretty much everywhere in your body. It entered the bloodstream, now it's everywhere. So stage 3, if you catch it, stage 3A, 3B, and before, better chance. All right, let's move on to the disorders, skin and hair disorder. Alopecia we mentioned earlier. Males usually have male pattern baldness, which is a sex-linked trait. So it's the mother. The mother gives a trait to the son. Alopecia is similar, but it's usually just thinning of the hair. Women will get alopecia more often. It is genetic as well, but it's not sex-linked like male pattern baldness. Cellulitis, so inflammation of the skin tissue. Sometimes swimmer's rash. Dermatitis, inflammation of the skin. In this case, it could be a rash that's caused by eczema. You guys know what eczema is? You guys seen it? So it's usually young children, and hopefully they grow out of it as they age. So it's their own immune system, for some reason, attacking the healthy skin cells. So there's certain triggers. Sometimes it's diet, sometimes it's stress that might cause a flare-up of the eczema. But usually it's the young child, and they tend to grow out of it. Inflammation of the follicle. So here it's the hair that may have been infected. Herpes. So there's hundreds different types of herpes virus. So as we know, virus attacks DNA, which can lead to mutation, which causes a tumor, which then can lead to cancer. So simplex 1 is usually in the oral area, whereas simplex 2 is in the genital area. The virus doesn't care. As long as it's skin that it can infect, it'll go ahead and infect it. You guys heard of HPV? Human papillomavirus. So that is the culprit in cervical cancer. There is a vaccine, Gardasil, for the top viruses that causes cervical cancer. But get your pap smear. You should be able to detect it early and get it treated. It's the gift that keeps on giving, right? So it doesn't matter if you have an outbreak or not. If you pass along the virus, you're going to pass along the disease. Herpes zoster, so a different type. So we have chickenpox and shingles. So varicella, there is a vaccine for chickenpox. There's also a vaccine for shingles. What's the difference between these two? Yeah, chickenpox is the first time you get the virus. And usually it's not that bad if you get it when you're young. So that's why parents like to expose their children to chickenpox when they're young. But nowadays we have the vaccine. So you get the vaccine, like any other virus, it stays in you forever. So the gift that keeps on giving, because there is no cure. So the first time you have it, it'll cause blisters, rashes, but then it'll hide. It'll hide in the nerve cells here along your dorsal area. So when you're older and the virus comes out and start to infect cells again, usually because you might have stress or a weakened immune system, they'll cause blistering of your nerve cells here in your trunk area. You guys probably seen the commercials for shingles. It can occur anywhere on the body. It could be on the face, but you'll see blisters because of the outbreak. Bacteria infection. So this is highly contagious. Make sure you have your personal protective equipment when you enter into these rooms, these hospital rooms. There'll be a sign that'll let you know if there's a infectious agent or a resistant organism, an organism with drug resistance. Just post a sign, just make sure you know which PPEs to use. Head lice. So capitis is on your head. Corpus, just like a corpse, is on your body. And then in your pubic region, pubis. So they just name it based on where the lice is. Have you guys heard of scabies? Scabies are similar to lice, but they'll actually embed themselves into your skin. So if it looks like you got a bunch of little pimple blisters, that's not pimples. It's actually the little insects burrowing themselves into your skin. So treatment, shampoo, medicated, creams, leave it overnight. Next day you shampoo it out and it should kill everything. Psoriasis. Who usually gets psoriasis? The young adult or the old? So it's usually the young adult. So if you're a child, you usually get eczema. But when you're a young adult, teenage years, you'll usually get psoriasis. So psoriasis is similar to eczema. It is also an autoimmune disease. And similar problems with the skin, you get patchy, scaly areas that is very itchy. One trigger that might cause a psoriasis outbreak is gluten. Have you guys heard of gluten? So that's the protein in wheat, rye, barley, so all the grasses. So if you cut out some of your wheat protein, gluten, then your psoriasis should subside. Psoriasis not only attacks your skin, but it can also attack your joints. So you can have psoriatic arthritis. So instead of attacking healthy skin, psoriasis now attacks healthy joint cells as well. Ringworm. What type of worm is it? It's a fungus. All right. So fungus are decomposers. So that means they usually only consume dead things. So this is a fungus, just like athlete's foot or a yeast infection. But in this case, you go to the gym, you use somebody's towel, or you didn't wear flip-flops, and you got some of that fungus on your skin. It eats away the dead skin, and it can't really eat the living skin, so it has to move a layer outwards, and that's where you get the pattern. So eat all the dead skin here, and then it'll have to grow outwards to eat the next layer of dead skin. So that's why they call it ringworm, because of that pattern. Athlete's foot, teeny on the feet, on the head, or on the body. Okay. Have you guys ever heard of going commando?
Yes.
What does it mean to go commando? No underwear. So where'd that come from? Going commando. Yeah. From the military. Why did the military not wear any underwear? Are you guys freaky like that or what?
Let it breathe.
Yeah, exactly. So when they were stationed in the rainforest, you get jungle rot. So basically fungal infection. So if you have a bedridden patient, you don't move them about for circulation, you'll get jungle rot. Anywhere there is moist and warm, you'll get fungus. Folds of skin, in between the buttocks, under the breast. So going commando, those men, those soldiers stationed in the rainforest, they remove their base layer. So socks, underwear, undershirt, they removed it all to prevent infection, fungal infection. Rosacea. So this is vascular. You got little blood vessels that dilate. Usually on the cheeks. Looks a little bit like could look a little bit like a rash. Scabies. So scabies are similar to lice as mentioned. They bury themselves into their skin. So you might have to treat the whole family, get rid of any bed linens, or clean them. This image right here is hair mites. So we have them right here in our eyebrow and on our nose. So what this is a hair shaft, and these little things are the butts of the hair mites. So they're sticking their head down the hair shaft and they're feeding off the oils that you're giving off, all the sebum. So here you got 1, 2, 3, 4, 5, 6, 7, 8 of those guys sticking their head down into the pore. Yeah, can't be gross. Warts are caused by viruses, so that means this is a tumor, and tumors can lead to cancer, vicious cycle. Have you guys used Compound W before? So the way you want to use Compound W is you'll put a drop of the medication on top, and you'll need it to dry. So it's a plaster. Put it on top, and then you'll put the cover over it. So what the drug, the plaster, will do is basically dissolve away the wart. And then when you remove the cover, hopefully, no more wart. So Compound W. All right, that brings us to the end of the skin. So let's go ahead and do week 1, day 2. Your access code will be